You hear the term polycystic kidney disease, or PKD, but what does it actually mean? It's this genetic condition that has a massive impact on people's lives, yet it's so often misunderstood. So in this explainer, we're going to break it all down, what it is, who it affects, and really why understanding it matters so much. All right, let's jump right in. So the name itself, it actually gives us the biggest clue right off the bat. Polycystic. If you break it down, poly means many, and cystic, well, that's about cysts. So, many cysts. And that is literally what this disease is all about. It's the perfect starting point for us to figure out how these cysts can end up causing such huge problems for the kidneys.
Okay, so here's our game plan. We'll start with what PKD even is. Then we'll get into the two very different types, adult and infantile. We'll spend most of our time on the adult experience, because it's more common, and cover how it's diagnosed and managed. Then we'll touch on that rare infantile form, and, of course, wrap it all up with the key takeaways.
All right, so first things first. This is where it gets really interesting because PKD isn't just one thing. It's really a tale of two completely different conditions that just happen to go by the same name. Let's dig into what makes them so different. Just look at this breakdown and lays out the key differences perfectly. And that first line, inheritance, that's absolutely crucial. Adult PKD is autosomal dominant. What does that mean? Well, think of it this way. You only need to get the faulty gene from one parent to have the condition. It's dominant. But infantile PKD, that's autosomal recessive. That means a child has to inherit a copy of that faulty gene from both parents. It's a whole different genetic lottery. And you can see right there, the age it shows up, even the specific chromosomes involved, totally different.
Okay, so let's zoom in on the more common form first, the one that affects the vast majority of people with this diagnosis. We're talking about adult polycystic kidney disease, or ADPKD for short.
So what's the culprit here, genetically speaking? It all boils down to a mutation on one of two very specific genes, and they're conveniently named PKD1 or PKD2. That one tiny genetic error, that's the starting pistol for everything else that's about to happen. So what does this genetic hiccup actually do? Well, it tells the body to form cysts in the kidneys. And listen, we are not talking about just one or two. We're talking hundreds, sometimes even thousands of them. Imagine tiny little balloons just inflating all over the inside of your kidneys and just slowly getting bigger and bigger year after year. And that right there is the core problem. As all those balloons grow, they start to squeeze and crowd out all the healthy, working kidney tissue around them. And you got to remember, the kidneys are our body's essential filtration system. When they can't do their job clearing out waste, that's a big problem. Over time, this relentless pressure just causes a slow, steady decline in kidney function, and eventually it can lead to outright kidney failure. This is what makes the disease so sneaky. For a lot of people, it's completely silent for the first 20 or 30 years of their life. I mean, the cysts are there and they're growing, but just not enough to cause any real trouble yet. It's usually not until someone hits their 30s or 40s that symptoms finally start to pop up, as that kidney function really starts to take a hit.
So what are the red flags? What would you actually notice? Well, the number one most common sign is high blood pressure, especially when it shows up at a fairly young age. But on top of that, people with ADPKD can get this dull, nagging pain in their sides. That's the kidneys literally stretching. They can also deal with recurring UTIs, and sometimes more alarming signs, like seeing blood in their urine, which can happen if a cyst bursts.
Now here's a really crucial thing to understand about adult PKD. It's what doctors call a systemic condition, which basically means the problems don't always stay neatly locked up inside the kidneys.
Yeah, those cysts can actually show up in other organs too. The liver is the most common spot. But what's much more serious is that patients have a higher risk of developing something called a berry aneurysm in the brain. It's this little weak spot in a blood vessel that can be incredibly dangerous, even life-threatening if it bursts. It really drives home how this kidney disease can have major implications for the whole body, especially the cardiovascular system.
So the big question is, how do you even find out if someone has this? And maybe more importantly, what can you actually do about it? Let's get into the diagnosis and management side of things. You might be surprised to learn that the go-to diagnostic tool is actually really simple and totally non-invasive. It's just a standard ultrasound. That's all it takes for doctors to get a clear picture, to literally see the cysts and figure out if they meet the official criteria for a diagnosis.
And as you can see here, the criteria are super specific, and they actually change depending on your age. So, for someone from a high-risk family who's in their 30s or 40s, a doctor only needs to spot a couple of cysts in each kidney to make the call. But for older folks, that number goes up, and that's just because simple, harmless cysts are more common as we all get older anyway.
So what's the playbook for managing this? It's really a multi-step journey. Step 1 is all about daily management, things like aggressively controlling blood pressure, drinking tons of fluids, and making dietary changes. After that, it's about actively treating any complications that pop up, like UTIs or pain. Down the road, as the disease progresses, some people will need renal support like dialysis. And ultimately, for end-stage kidney disease, the only real cure is a kidney transplant.
Okay, now we need to talk about the other side of this story. We're going to completely shift gears and look at the much, much rarer and frankly often more devastating infantile form of PKD.
So what happens when this disease doesn't lie in wait for decades? What happens when it shows up in the first few years, or even the first few days of a child's life? Well, that's when we're talking about autosomal recessive polycystic kidney disease, or ARPKD.
In this form, it's a completely different ballgame. Like we said, it's recessive, it's linked to a totally different chromosome, and it is just so much more severe. It usually shows up in childhood, and it's also connected to major scarring in the liver. And tragically, for babies diagnosed with the most severe form right at birth, it can be fatal within a matter of months.
And this is probably the starkest difference of all. Unlike the adult form, which can be managed for many, many years, there is simply no cure for infantile PKD. The focus of care is completely supportive and palliative. It's all about managing the symptoms and the complications to give that child the best quality of life they can possibly have.